Welcome to this IHF program. My name is Emanuele Barbato, interventional cardiologist from Rome, Italy. And I have the pleasure to be here with my colleague and friends, Giuseppe Rosano, from heart failure specialist from London in UK. Welcome, Giuseppe.
Thank you, Emanuele.
Today we speak about cardiac amyloidosis in aortic stenosis patients undergoing TAVI. This is a topic of increasing interest in our community, but let's start asking the first question to Giuseppe. Why is that important to understand if a patient is affected by cardiac amyloidosis?
Yeah, Emanuele, first of all, up to 20% of patients with aortic stenosis have cardiac amyloidosis. So given the increased use of TAVI for these patients, we need to know whether those patients that we implant have also cardiac amyloidosis, because that will affect their prognosis. But since today we have good weapons to treat amyloidosis, then you see that if you treat the aortic stenosis, then it's mandatory to treat the amyloidosis. And there are cases where you may decide not to treat with TAVI.
So if I understand well, it's not a mere curiosity to diagnose the cardiac amyloidosis in these patients, but it really impacts the prognosis. So in a way, this could also inform heart team decision making, whether it is worth treating the patients with TAVI or not. But let me understand, is there any patient profile, risk factors, risk score that will allow us to more or less perceive if a patient is also affected by cardiac amyloidosis?
Yeah. The heart failure patients are those presenting with shortness of breath. I mean, they're probably those as a red flag, but the red flags are usually carpal tunnel, the presence of peripheral neuropathy, macroglossia, but also the increased septum. But the increased septum is frequent in patients with aortic stenosis. So you have to look at GLS and see especially the apical sparing that is typical for patients with amyloidosis.
So, and those are the patients, if I understand well, that would need additional diagnostic examinations in order to confirm the final diagnosis, right? And what are the additional tests we should do in these patients?
First of all, you need to do the urine test and full blood count and test, but also then a whole body scintigraphy, because that will show you the uptake of amyloid in the heart.
Another point which is of importance specifically to interventional cardiologists is whether this patient has also renal function impaired because of cardiac amyloidosis, because in a way this could also affect our procedural protocol, right? Any words on that?
Yeah, it is important to look for renal function, because the amyloidosis and impaired renal function, as you said, go hand to hand. And that has an immediate importance for the procedure, but also is an important parameter for looking at the progression of amyloidosis.
That's extremely interesting. So let's say we've done the diagnosis. We know that the patient beyond the aortic stenosis that is being treated shortly with TAVI has also a cardiomyopathy, a cardiac amyloidosis. We know that prognosis would be good once the aortic stenosis is treated and medical therapy is being adapted. So TAVI is done. What's next for these patients?
So if TAVI is done, it means that the MDT have established that the prognosis medium-long term is good. So those patients need to start treatment for amyloidosis. And today we have all different drugs. I mean, we have 3 different classes of drugs that can be used alone or in combination. So it is mandatory that before discharge, patients have a discharge plan that involves the starting a treatment for amyloidosis.
That's very well said, Giuseppe. So if we want to sum up what we just learned from this discussion, is that first, cardiac amyloidosis in aortic stenosis patients undergoing TAVI is not to be neglected. It is quite frequent, as we heard, up to 1/5 of our patients might have that. We need to know this upfront, because we need to, first of all, establish what is the prognosis of these patients beyond the TAVI in itself. And lastly, once we have diagnosed and treated these patients with TAVI, then we can further follow up this patient with an intensive medical treatment specific to the cardiac amyloidosis phenotype that this patient has. So please follow up on our social media and on our channels, because IHF is this and much more.